if he will make a statement on the granting of an emergency licence to allow the return of medical cannabis for Billy Caldwell.
Minister Nick Hurd.
Mr. Speaker, over the weekend, my right honourable friend, the Home Secretary, issued an emergency licence to allow Billy Caldwell's medical team to access cannabis-based medicine. This was an emergency procedure and was led by a senior clinician with the support of the medical director at Chelsea and Westminster Hospital. Mr. Speaker, I'm sure the whole House will want to join me in expressing genuine concern for Billy's health and will be pleased with the news that he has been discharged from hospital today. The course of action in this case, Mr. Speaker, was unprecedented. I should explain that our guiding principle is that any process in this context must be clinically led and evidence-based. To date, Home Office policy has been to permit the production, supply and possession of raw cannabis solely for research purposes under a Home Office licence. The cannabis-based medicine Sativex is currently the only one that can be prescribed in the UK because there is a proven case for its safety and efficacy. However, this case and that of Alfie Dingley and others has shone a light on the use of cannabis-based medicine in this country and highlighted the need for the government to explore the issue further and our handling of these issues further. I recognise the need to ensure that the approach to licensing works more effectively. As a first step, I can announce today, Mr. Speaker, that the government is establishing an expert panel of clinicians to advise ministers on any individual applications to prescribe cannabis-based medicines. This is consistent with the principle that a clinician must be at the heart of the process. And I've asked Dame Sally Davis if she will take forward this important work. Let me be clear, Mr. Speaker, both the Home Secretary and I, as fathers, as the rest of the House, as the rest of the country, have of course been profoundly moved by Billy's story, as well as others like it. But I want to reassure the families and the public today that the Home Secretary and I are working together to do all we can to take forward the necessary steps at pace, and more announcements will be forthcoming.
Tonia Antoniazzi.
Thank you, Mr. Speaker, and I would like to thank the Minister for coming to the House to discuss this urgent question. But now the Home Secretary has conceded that cannabis has medicinal benefits by granting the emergency licence for Billy Caldwell on expert advice. When can we expect to see more import licences to make medicinal cannabis available to all who would benefit it? And moreover, will the government support my honourable friend for Newport West's bill on the legalisation of cannabis for medicinal purposes when it returns on July the 6th? Mr. Speaker, on the 20th of February, an urgent question was raised by the Honourable Member for Reigate about Alfie Dingley's case. Billy Caldwell is in exactly the same situation. The Minister told the House that he would undertake to explore every option within the current regulatory framework. 119 days later, the Government still has not granted Alfie Dingley his medicine available in 37 other countries. And the Prime Minister met Alfie in Downing Street on the 20th of March and was told that the Government would do all it can to help him. Billy Caldwell, hospitalised last week. It's excellent news that he is out from hospital today. But, after having his prescribed medical cannabis taken off him by customs officers. And honourable members will have heard with alarm the Health Secretary say this morning it's going to take months before a system is in place to get medicinal cannabis supplies to these children. But it's not just these children, it's to other patients who require this. Will the Minister give an assurance that when Alfie Dingley comes to Parliament on Wednesday with his mother, he will have had his medicine? Moreover, I have 2 children in my constituency, the only 2 in Wales, 2 of 15 in the United Kingdom, who have a very rare genetic disorder called NKH, a serious life-limiting condition. Charlie Jones, who is 6, and Jace Newton-Seeley, who is just 1. Both suffer from frequent debilitating cluster seizures. Both would benefit hugely from using medical cannabis, according to their consultant neurologist with whom I spoke with earlier. Now, Charlie's granddad, Ian Gilmore, has been in contact with the Home Office since 2014 when he learned of the benefits of cannabis for Charlie. But he has been given conflicting advice, he has been pushed from pillar to post and fobbed off. Can the Minister say when his department is going to get a grip of these procedures? Because why the delay until now? Why is an announcement not being made today that this medicine will be available now to all that need it? And many patients are illegally, and this is what I have a problem with, many patients are illegally accessing cannabis, which opens them up to using the wrong form of the drug. The government has a duty to protect these patients and sufferers, and when will he act?
Order.
Sorry.
Order. Forgive me. I've granted this question because it's urgent, but the Honourable Lady's already exceeded her time by 50%. I assume that she's drawing towards a conclusion, very briefly, with a couple of question marks.
I will right now. Okay, so why is the government stuck in the dark ages? What can the Home Secretary do to speed up this process? When? Next week, next month, in due course? These answers simply are not good enough, Minister.
Well, I thank the honourable lady for those long list of questions, and I'll do my best to answer them. She asked about recognition of medical benefits of some cannabis-based medicine. That is, as I said in my response to the urgent question, already recognised by the fact that, for example, Sativex can be prescribed in the UK because there is a proven case for its safety and efficacy. It has been rigorously tested, and she will know the responsibility that the government, everyone involved in this process, has to make sure that medicines are safe. But there is within the system licence to prescribe medicines once they're established and tested. And she mentioned the case of Alfie Dingley, which I'm very familiar with and close to, and I made it clear at the dispatch box. However, we may feel about the current rules. I undertook to try and find a solution within the existing rules for Alfie Dingley. It is, again, unprecedented territory because it's the first time that we are considering a personal licence. So this is new ground for everyone, but I can confirm to her, as I confirmed to the family, that process of applying for a licence to find a long-term, sustainable, legal solution for Alfie is well underway. It is now clearly clinically led, and I have given assurances that we will drive the process as hard as possible, and indeed a date has been set for a compliance visit, which is a necessary part of the process. So we are pushing that as hard as possible, and I'd like to place on record my thanks for and appreciation and respect for the dignity and patience of Alfie's family in this very, very difficult situation. She challenges us to change fast, and what I think I've made very clear is the recognition that we do, as the Prime Minister said this morning, we have to look again very hard at our processes and how we handle these situations, and make sure, as the Health Secretary made clear today, that our policy is fully up to date in terms of the best possible understanding of the most recent and relevant evidence. As government, we have, and I'm sure she'll appreciate this, to take a bit of time to think things through. We have to get the detail. We have to get the detail right. We don't have the luxury of opposition. We have to work through the detail to get this right. But there is a recognition today in my statement, not only that we are taking immediate steps to improve our processes so that it is more clinically led than it is at the moment, with the introduction of a new clinically led panel of experts to advise ministers, but I've also indicated that we are taking a wider look at policy process and will be making forthcoming announcements.
Rhian Duncan-Smith.
I welcome my right honourable friend's statement. I'm by no means a supporter in any way of recreational cannabis use. However, a woman that I know, Amelia Powers, was given 2 weeks to live with a diagnosis of a tumour in the brain. There was nothing more they could do. She took to using a form of this, and for the last 7 or 8 years has not just reduced it but got rid of this tumour, and now basically runs her own company that she started. The point that I would make is this is somewhat wider than this. The biggest problem I think he faces is that in the health department it is still not considered a good thing to do to actually investigate the medicinal properties of this particular drug. I would urge him, if at all possible, to try and get some coalition on this to get this investigated, because there clearly are medicinal preparations that can be used, and it would be really, really helpful if he would make sure he drove that.
Minister. To my right and friend, I suspect everyone in the House has personal knowledge of people, or indirectly, who people who swear by the benefits of cannabis-based medicine that has helped them in very difficult circumstances. I completely do understand that. To his point about building a coalition across government around updating the evidence, I think, again, I've signalled in my remarks that is exactly what is happening. I have the Minister for Health sitting alongside him, and I refer him to the comments that the Secretary of State for Health made this morning, which make it clear that the government is seriously looking again at our processes and how we handle these cases.
Diane Abbott.
Is the Minister aware that the public is increasingly dismayed by the government's handling of this question of cannabis oil for medical use? And let me remind the Minister that the concentration of the relevant compounds in cannabis oil is so small that nobody could possibly get any recreational use from it. I accept the Home Secretary moved swiftly to allow a short-term supply for Billy Caldwell. But overall, the government's management of the current system of issuing licences for cannabis oil has been lamentable. It has left people in pain and suffering, and families anxious and distraught. It seems to us on this side of the House that the current system, even with the expert panel he refers to, is simply not fit for purpose. This is why Labour in government, mindful that this oil is legal in many other jurisdictions, will move towards a legal framework which allows the prescription of cannabis oil for medical use. We believe that such a move, taken with all due care and tests and so forth, would have support on both sides of the House and would be welcomed by the British public, who are weary of the chaos and the confusion and the personal tragedies caused by the government's current management of the system.
Well, I thank the Right Honourable Lady for recognising the speed of movement this week by the Home Office in response to an emergency request from clinical leads of the Chelsea and Westminster. The Home Secretary overruled nothing in this process. We worked together very closely during this week and responded, as I said, very decisively to an emergency request for a limited licence in a direct call from the senior clinician and the medical director at Chelsea and Westminster. I do understand the point she makes about public sentiment on this. I think people are unsettled by what they have seen this week. I totally understand that. Where I do regret, and the fact that she's trying to make a party political point about this amendment, because of course she was in power, and Labour were in power for a long time. They did the square root very little in this context, and the system that we're trying to work with now are basically the rules we inherited from the last Labour government. So I don't think anyone in politics is in a position to take a moral high stand on this issue. What we need to give is undertaking to ourselves that policy and processes are most informed by the most up-to-date evidence, and we challenge ourselves harder to make sure that these processes are more clinically led than they have been in the past.
Dr. Caroline Johnson.
Speaker, and I refer members to my declaration of interest as a consultant paediatrician. Some compounds with cannabis do have anticonvulsive properties. Cannabidiol has been shown in animal studies to have active anticonvulsant compounds, but THC, the one that is legal in certain concentrations, has been found to have both anti- and pro-convulsant properties in animal studies, and there are concerns that it may also be responsible for causing significant psychological problems such as psychosis if it is used over a long period. Epidiolex is a pharmaceutical-grade, quality-assured product made with cannabidiol but less than 0.1% THC, which is both legal and is used for clinical trials in this country already and in children too. The oils available on the internet or at health food shops are not subject to that scrutiny, do not have the same level of quality assurance and have variable levels of concentration. Does my right honourable friend agree with me that there is a huge difference between these two products, the quality assured one and the not quality assured one, and that what we need to do is investigate the best possible scientific evidence to ensure that the usage and benefits of cannabis-based medicines so they can be used safely and properly to the best effect for our patients?
Well, I defer to my honourable friend's medical knowledge, and in fact her intervention just reinforces the point I'm trying to make about the need for this process to be clinically led as far as possible. And the point she's making about that, if certain cannabis medicines, certain conditions, the evidence is at best mixed on this. And she makes the fundamental point about our responsibilities as regulators to make sure that, that people are accessing and using products that are tried and tested as safe as possible. Imagine the consequences of prescribing an unregulated medicine that goes wrong. Imagine the scene in this House at that point. So in our understandably emotional response to recent events, we must also make sure that we do policy right and get it right. And that's why we require a little bit more time to come back to this House with more detailed plans.
Joanna Cherry.
Thank you, Mr. Speaker. The Scottish National Party is in favour of the decriminalisation of cannabis for medicinal use, given the evidence of the benefits it has in alleviating some serious conditions, such as that suffered by young Billy Caldwell and also by young Alfie Dingley. So what we'd like the government to do is to look very seriously at the evidence for decriminalising the use of cannabis for medicinal use. And if they're not prepared to do that, we'd like them to devolve the power to Scotland to do that so the Scottish Government can take steps. However, I stress that we'd like to see this done for everybody in the United Kingdom. So I have two questions for him. When can we expect the Government to look seriously at the evidence and to bring forward these matters for proper debate in this House? And if that's not going to happen, when will he allow the Scottish Government to take the appropriate steps for people in Scotland? Thank you.
Well, can I thank the Honourable Lady for that question? She's absolutely right to insist on the importance of an evidence-based approach. And, of course, the Home Office does regularly keep evidence under review, and as I've said at this dispatch before, one of the key milestones in this process is to review what the WHO feel about this, because they're conducting a major review on that. But what we're actively considering now as to whether there is an argument for taking more urgent step in terms of reviewing the evidence and the processes and the way we handle these cases, and I will keep the House informed of that.
Dr. Julian Lewis.
Does my right honourable friend the Minister accept that there is nothing new and no inherent contradiction in having available for medicinal use addictive drugs which one would not allow for recreational use? And can I illustrate this by my personal experience 32 years ago when recovering from severe back surgery, when I was given a rather pleasant drug for which I asked for a repeat prescription, only to be told that as morphia, which is what it was, is related to heroin, there were limits on how much they were going to give me. So why can't common sense prevail in the case of marijuana as occurs in that case too?
Well, I thank my right honourable friend for sharing that personal experience and bringing back what was clearly some happy memories for him. And I understand the point he makes, and I come back to what I was saying. We are absolutely serious about reviewing urgently our processes and policy in this area to make sure that we're consistent and as up to date as possible. And I've signalled today that we recognise, as the Prime Minister did this morning, that we need to make some changes to how we handle these cases, which is why I've introduced the first step that we've taken today.
Norman Lamb.
Thank you, Mr. Speaker. Isn't it actually utterly shameful that in this country we continue to criminalise people who use cannabis in various forms for medicinal purposes, including the relief of pain, pushing people into the hands of criminals who have no interest in their welfare at all? And what on earth is a Home Office minister doing responding to a health issue? Surely it should be the responsibility of the Department of Health.
Well, to the 2 points, and the honourable gentleman, I go back a long way. I have a great deal of respect for his position and experience. I just simply make 2 points. In terms of the rules, they are as they are, and he as a former minister knows that ministers are bound by the rules. We can debate in this place, and we can challenge in this place, as we are, I think, beginning to do, whether those rules are fit for purpose. That is the right thing to do in a representative parliament. In terms of my role in this, I've signalled today very clearly that we are looking again very clearly at our process and how these cases are handled, and I've signalled very clearly that we believe strongly that these need to be more clinically led, hence the appointment of a panel. As to which ministers decide and where that sits inside the system, again, that will be part of that consideration of how we handle these cases more effectively than in the past.
Mr. David Tredynick.
Mr. Speaker, thank you. Can I, right honourable friend, give an assurance that having taken this important initiative, other similar cases will be treated with similar leniency now and not wait for the wheels of government to grind along slowly?
I don't think the wheels of government move slowly this week at all, far from it. In response to an emergency request, we issued an emergency and limited licence very quickly out of recognition for the very, very difficult situation we were in. But I can give you assurance that we will always seek to treat each case as consistently as possible, and that goes for Alfie Dingley and Sophia Gibson and the others. It's important that we are consistent, but in this case we were dealing to an emergency request for an emergency licence.
Alfie met the Prime Minister 8 weeks ago, and she instructed the Home Office to act. Saturday he had 30 seizures. Would the Home Office give the Right Honourable Gentleman who's seeking your eye, Mr. Speaker, myself and Lady Meacher, the authority to go through border control with those drugs that Alfie needs? If you won't act, may we?
Yeah.
I don't think that would be necessary with respect to the right honourable. He is also a lawmaker. He shouldn't be a lawbreaker. In the case of the Alfie Dingley case, what I will say is this, we have made it quite clear that we will do everything we can within the existing law to find a solution. We've had a bit of a stop-start to it because this is new ground, it's very complicated, has to be clinically led. He possibly doesn't know the underlying details of this, but I can assure him that I am assured that the process is now firmly on track, and I hope that we're in a position to make a positive decision as soon as possible.
Antoinette Sandbach.
Thank you, Mr. Speaker. I have a constituent who has a 2.5-year-old son having 300 seizures a day, describing these as each one resetting his brain like a computer hard drive being wiped. Following the use of CBD, these seizures have been reduced to between 30 and 50 a day. Will the Minister meet with me to discuss this case and perhaps meet with my constituent, because he has an outstanding application for a medical licence in his son's case?
I can certainly give that assurance, and I will offer, of course, to meet him as I've met with every single family that's come forward, because we are absolutely serious in trying to help as far as we can, because these are deeply difficult cases. But I come back to the point, which I'm sure she will absolutely respect. It shouldn't be really down to politicians making this. This has got to be a clinically led process. And when the clinicians came forward this week on behalf of Billy, we were able to respond to requests for emergency help. But this has got to be a clinically led process.
Ronnie Cowan.
Thank you very much, Mr. Speaker. The facts here are that Billy Caldwell and his family had not taken this to the limits of the weekend, the government would still be sitting on their hands. The good news is the government for the first time acknowledged the therapeutic value of medical cannabis. I'm asking the government to expand this to people suffering from multiple sclerosis, Parkinson's and certain cancers. It's happening in 30 of the United States, and 12+ countries in Europe are already doing this. I'm asking this government to legislate to bring forward medical cannabis under prescription in the United Kingdom.
Well, the honourable gentleman is expressing a view that I think is held in many places across the House, that legislation needs to be revisited, and that this is the right place to debate that. I refute what he was saying about the government sitting on its hands in relation to the Billy Caldwell case. We worked very hard during the week to try and find solutions to a very difficult situation, but the government is always going to be bound by the rules of the day, whatever people think about them. I'm just very glad that we could find a temporary solution for Billy, and I hope that that's a step towards the long-term solution he deserves.
Sir Desmond Swain.
Even if clinically led, will he ensure that this process is not administered by a bureaucrat, but rather is electrified by a politician alive to the need to be re-elected?
No, of course this process has got to be driven at pace, as it was this week by the team at the Home Office. And in fact, I'd like to place on record my thanks to the officials who worked extremely hard to find a solution to an emergency response this week. But I come back to the point that this needs to be clinically led, and in asking Dame Sally Davis to take forward the important work of setting up this panel, I don't think I'm talking to a plodding bureaucrat.
Caroline Lucas.
Thank you, Mr. Speaker. Further to the question from the Honourable Member for the New Forest, does the Honourable Member agree that it is unfathomable that medicinal opiates, the same family as heroin, can be prescribed for medical reasons, usually pain relief, yet medicinal cannabis can't be, despite the strong evidence base that it should be? And crucially, can the Minister give us the evidence base that is informing the government's position?
Set it up.
The evidence case comes from the official advice from the Advisory Council and others, has been set there for some time, and the rules that we're having to work with in our rules that have been around for a while under successive governments. Now, if this is the moment to revisit those rules and challenge those rules, that is the role of a parliamentary democracy. What I'm saying is the government has reflected deeply on the events of the last few weeks. It's constantly updating the evidence from the WHO and others, and is actively discussing changes to the way we handle these cases. And I've made one announcement today and expect others to follow.
Thanks, Al. Crispin Blunt.
Can I thank my right honourable friend for the way he personally intervened on Friday afternoon as it became clear about the deterioration in Billy Caldwell's condition, and the response then from the Home Secretary within hours of him becoming aware of that. Can I also, he knows that he has received advice from me as co-chair of the all-party group on drug policy reform about how the government should navigate its way out of this. I would offer myself in order to assist in the review that is going on. Could he also take advice from Charlotte Caldwell, who I've met a number of times before this week? She is a redoubtable campaigner, and she is an expert in this field, born of necessity. So I would hope they would take up her offer of engaging with her in this process. And finally, Mr. Speaker, can I just say that I do have an anxiety that the framework of this review, if it is within the current law, could end up with the wrong answer. The problem is the current law is based on the wrong premise, that there is no value in this medicine.
Well, I thank my honourable friend for his comments and for his extremely constructive approach to a very difficult situation, and I thank him for that. He will get a reply to his helpful letter, and I fully undertake to engage with him and with anyone who has got strong views and opinion, and particularly expertise in this area. As I said, we have to make sure that policy and process are up to date, informed by the best evidence and the most up-to-date evidence, and that is what we undertake to do.
Johnson.
So the Minister has already referred to the role that's played by the Advisory Council on the misuse of drugs, and I wondered if he could say he's also announced an expert body to look at this issue. So can you just say, what is the Advisory Council currently saying to the government about this particular issue?
What I say is their advice hasn't basically changed about the lack of evidence around medicinal benefits of cannabis-based medicines. But this is a process that needs to be, as we do, constantly review in the light of of the evidence. I should clarify one point. The clinical panel that I've announced today is there to advise ministers on specific claims and applications that come to us. I should make that clear.
Sir Mike Penning.
Mr. Speaker, the Minister will know that I was there at number 10 with him and the Prime Minister, Alfie's family and Alfie. I can't see the difference between the wonderful news that Billy has been given his drugs on clinical advice and the advice from Alfie's and others. And the reason for this difference is because it is in Schedule 1, which is why it's in the Home Office. It shouldn't be in the Home Office, it should be in the Health Department. Now, Alfie will get his drugs, I'm sure, very soon, but it's not soon enough for many others.
Well, I understand the point Ralph from made. He's been a tireless and persistent campaigner, both for Alfie and others in this case, and I share his hope that we can process the Alfie application as quickly as possible. It's now on a much better track. This is complicated. This is new ground for everyone, not least the clinical and medical community. But we are finding our way towards finding a legal, sustainable, long-term solution, as well as reviewing our processes and the way we handle these cases, as I've outlined today.
Hannah Bardell.
Much, Mr. Speaker. Is it not the case that it is becoming policy by public outcry, and that it should not take such desperate cases for the government to revisit and relook at its policy? A constituent of mine has relapsing and remitting multiple sclerosis. She suffers serious pain every day, and it is her specialist that thinks medicinal cannabis is the way forward for her pain relief. Will he look at her case if I write to her, and will he look very seriously at expediting this as quickly as possible for all of our constituents?
Well, I hope I can do better than that and invite the clinical panel, once it's set up, to look at the case. The point is that within the rules at the moment, as we're trying to demonstrate through the Alfie Dingley application, we are prepared to look at individual licence on exceptional cases. Is it taking as quick as I or anyone would like? No, but this is new, this is difficult, we need to get this absolutely right, not least to make sure that these licences stand up to scrutiny and legal challenge. So I hope we're going to get there very soon. I've given the family my absolute assurance that we are going to drive this process as hard as possible, as we will do for other applications in the new system that we're setting up.
George Freeman.
Speaker, as the former Minister for Medicines Regulation, could I welcome the intervention of the Home Secretary and the Policing Minister this week? When I, as Minister, tried to look at this, the message I got was that it was the Home Office that was so tough on cannabis law that it wouldn't countenance it. So I welcome that the ministers are looking at this, and more importantly, the Prime Minister's announcement today that she's supporting a review. Can I urge him, though, to make sure that not to overcomplicate this? There are patients suffering around the country from acute conditions. It shouldn't be beyond the wit of ministers to put together a simple licensing and registration scheme so that those people are able to possess appropriate cannabis oil in a way that doesn't open up the market for recreational use.
I thank him for his comments and recognise his passion and leadership on this subject. I do come back to this point. It's all very well for politicians to express their views on this, passionately held, but at the end of the day, the people we've got to hear from are the clinicians.
Jeff Smith.
Speaker, can I just welcome this first step from the government? But the minister's just said that the government recognises the medical benefits of cannabis. So the question is, why on earth then is cannabis still a controlled drug under Schedule 1, which is for drugs with no medical benefit? It's time for an urgent rescheduling of cannabis, which would make life easier both for the government and for patients.
Well, what I was at pains to point out in my opening remarks is yes, when you look at side effects, cannabis-based medicine that is prescribed in the UK because it has a proven case for its safety and efficacy. And I'm sure he won't, like me, want to have the market full of unregulated products or untested where we don't know the long-term impact. So we do have to proceed with some sense of responsibility and get the detail right here. But we have shown at the Home Office that we are prepared to be flexible within the existing rules out of compassion for exceptional cases.
Thank you. When will the Commission start work? How will it operate? And how will it speed up the process of delivering these drugs?
Well, I thank my honourable friend. We've only announced it today, and I've just asked Dame Sally Davis to take forward this important way. There's a lot of detail to be filled in with consultation with her and others, and we will return to the House to fill in some of the detail that he asked for.
Jim Shannon.
I thank the Minister for his help so far, and thank him in particular for the meeting we had with my constituent Daniel Gibson about her daughter Sophie. The Minister will know, and the House needs to know, that Darren and Danielle Gibson took their daughter Sophie to Holland to receive the cannabis oil under prescription and controlled. During that 3 weeks we were there, she only had one seizure out of the dozens that she has every day. In the last 48 hours, she hasn't eaten or slept. Minister, there's 6 months of cannabis oil available for her, paid for, sitting in Holland at this moment in time for her to collect. What will I tell my constituent? Indeed, how long will the process take?
Well, as he and I have discussed before, and in the presence of Daniel, there is a mechanism, there is a process that can lead to legal, sustainable solution through a licensing process that needs to be clinically led. In this case, it's devolved to the Northern Ireland Association, as he well knows. But there is a process. We are feeling our way. We all want to drive it fast, but it does need to be done properly. In the situation that we had this week with Billy, what we were responding to was an emergency situation where clinical leads inside an institution came to us and said, we need this on an emergency basis, on a limited duration basis, because the long-term solution for Billy and others has to be clinically led. But we're responding to an emergency situation.
Thank you very much, Mr. Speaker. I'm sure many will agree with me that the great British public is very much behind the emergency decision taken by the Minister to secure the cannabis oil for Billy Caldwell. Will the Minister now look at whether other children like Billy and with clinical support should be allowed to legally access cannabis oil?
Well, as I've said in my previous answers, there is an active discussion about a review of how we handle these types of situations. But again, the core principle, as it was in the case this week of Billy Caldwell, is that this must be clinically led.
Matt Weston.
Thank you, Mr. Speaker. Does the Minister accept that the UK is behind the curve and public opinion on this matter of medicinal cannabis? And how does he explain the fact that Ireland introduced a purpose-designed special licence for little Ava Barry back in December 2017, yet the UK government appears to be dragging its heels?
I don't necessarily agree that we're behind the curve in public opinion. We moved very fast this week under extremely difficult circumstances, but where I agree wholly with the Health Secretary this morning is we do need to make sure that our policy is up to date, both in terms of medical evidence and the best interests of patients, and that's why I said there is an active discussion within Parliament about changes in process and policy. First announcement in that process today, and I'm sure as those discussions are finalised, there'll be more announcements to follow.
Bob Blackman.
Thank you, Mr. Speaker. This is a personal licence that's been issued. What liability, if any, is there for the clinician that believes this is the right treatment to be provided, given that this drug has not been authorised in the UK?
Well, what I'd say to my honourable friends, important point, is that as part of the licensing process, this exceptional limited duration licence for Billy, the paediatric consultant at the hospital, specifically stated that decisions about Billy's long-term care, decision-making about medication and supervision of his treatment should be undertaken by the paediatric neurologist, and we agree with that.
Susan Ellen-Jones.
Speaker, it seems to some of us that the biggest problem with the legalisation of this drug is the fact it's called cannabis. Some of us share the government's view that cannabis should not be legalised for recreational use, but this is a totally different situation. And while there is delay, we are seeing a situation where children and adults are in serious suffering and in some cases may die, when organisations like the MS Society are fully in favour of this legalisation. How long is it going to take the government to act?
Well, can I reassure the honourable lady? I understand the point she makes, but the government is very clear today and this week that this is a discussion about access to cannabis medicine and nothing else.
Andrew Percy.
Thank you, Mr. Speaker. There's clearly a consensus in this House for a review of policy in this area, but neither this House nor public opinion are experts. So can he assure me that we will always proceed on the basis of clinical evidence? And will he look particularly closely at the examples from North America of where recreational cannabis have been legalised, where medicinal cannabis has been legalised, the good, the bad and the ugly in those examples?
Well, I thank my honourable friend that input, and again, it comes back to the point. We've got to proceed on the basis of good evidence and the most up-to-date information, and some of the evidence in this area is mixed, and therefore we need to be very careful about how we proceed. That sounds bureaucratic, that sounds a bit ploddy in the moment, and I apologise to anyone who feels that way, but it is the responsibility of government to think things through and get things right and proceed on the basis of evidence and introduce more clinical leadership into this process.
Alison Hewlett.
Thank you, Mr. Speaker. The many constituents who have contacted me, who have MS, who have seizures and have chronic pain, will no doubt welcome the moves that this government has made, albeit perhaps not as fast as they would like. Could the Minister confirm whether this is a change in approach from the government to stop treating drugs as a criminal issue and to start treating them as a medical issue? He mentions he's taking advice from the Advisory Council on Misuse of Drugs on this issue, who also support supervised drug consumption rooms. Would he be willing to meet with me on this matter, which also helps to take away the criminal and make it a medical issue?
I'm happy to meet all members with an interest in this subject. I should say the government hasn't formally changed its position on medicinal cannabis. What we've responded to is an exceptional case and issued a licence to make sure that emergency treatment can be accessed. But what I have signalled is that we are looking again at the way in which we handle these cases.
Mr. Philip Holland.
I support the legalisation of cannabis for medical use and understand the need for a clinical lead on this issue. But given that there are a large number of countries which have already legalised this drug, there must be a mountain of internationally accredited research already being undertaken which the clinicians in the United Kingdom could access.
He makes a very important point, and I thank him for the emphasis again he's placed on the need to move ahead on an evidence, clinically led basis. And he talks about international evidence and international practice. He's absolutely right, and that is why we're taking great interest in what the WHO are doing in terms of updating their research and evidence and guidance on this extremely important, very complicated and very difficult subject.
In Jardine.
Thank you very much. Given that the Minister has said that clinicians must be taking the lead in this, can I ask when he will reschedule cannabis to allow clinicians to use their professional judgment in the provision of medicinal cannabis to children like my constituent, Murray Gray, who suffers from a very similar condition to Alfie Dingley, and will he meet with me to discuss that case, please?
Well, again, as I said, I've met all the families that I know about in going through these incredibly difficult situations, and everyone understands that parents will do absolutely anything for their children under these circumstances. I have huge respect for that. So, of course, I will do. The straight answer to the question is what we've demonstrated today, haven't completed yet with Alfred Dingley, is we are prepared to look at licences in a new way, but it does need to be clinically led, and that is the fundamental point.
And Jonathan Edwards.
Mr. Speaker. An advisory vote in the Senedd in support of legalising cannabis for medicinal purposes was hailed as a victory for common sense and compassion by Arfon Jones, who was the Police and Crime Commissioner for North Wales. Only 2 AMs voted against. Considering the political support in Wales and that health is a devolved issue, why won't the British government allow the National Assembly to make decisions on this issue on behalf of Welsh patients?
Well, it's not a devolved matter. At the moment, I'm more than happy to always have those conversations, but we deal with the system as it is at the moment.
Well, I'm most grateful to the honourable gentleman. Well, points of order don't really come now, but the right honourable gentleman can try. And if the right honourable, I'm even going to be helpful to the right honourable gentleman because my generous spirit is getting the better of me. If the right honourable gentleman's point of order relates to the matter with which we've just been dealing, then I feel that we can, on this occasion, indulge him. Point of order, Sir Mike Penning.
If you don't try, you never know, do you? Can I say that during the course of questions, the right honourable member for Birkenhead asked the Minister for Policing and Fire that whether or not it will be okay if members went abroad and brought this drug back in as a prescribed thing. And the Minister quite rightly said, that we're lawmakers, not lawbreakers, but we're also here to protect our population and our constituents. I think, and I say this with open heart and with genuine understanding of what the Minister's going through, because I tried to do this when I was in his position. If Alfie Dingley does not get his drugs by Wednesday, there will be a delegation from this House to go across and get those drugs for him.
Well, I'm very grateful, or at least I think I'm very grateful, to the right honourable gentleman. Manifestly, that wasn't even an imitation of or an approximation to a point of order, but nevertheless I'm sure it was extremely important, and the right honourable gentleman has unburdened himself of his opinions, and they're on the record for the people of Hemel Hempstead, the nation, and possibly even the world to study. Now, just before